Today I'm going to show you the 3 most effective bodyweight leg exercises to build strength in your legs, flexibility, and really what we're talking about is bulletproofing your knees for future problems. So you're going to have strong legs that can do what the legs need to do. Now, how you do the exercise determines the benefits, and that's why we go over everything, exactly how to do it, so you get the most out of your exercises. Welcome to the Anatomy of Therapy. I'm Dr. John Cybulski. I'm a chiropractor here in San Antonio, Texas. So if you guys have comments, questions to me about this exercise, about conditions you guys got going on, leave a comment below, hit the like button. I get back to all of those. I try to as well as I can. You guys have some great questions that I hopefully can direct you to someplace good. This is Juji Mufu. These are not the exercises. This is the opposite of body weight. I guess the hopping is kind of body weight. But the exercises we're going to do today are the reverse Nordic here from Mr. Frank Medrano. This one is tall kneeling. We'll go over that. And then we're going to do a deep squat. So we're covering the knee in all sorts of angles. Deep squat rock is what we're going to go over. And then we're going to do kind of a staggered sissy, but we're going to show you how to exactly do it to get the most out of it. Okay, the first one we're going to do is the reverse Nordic. So a Nordic is when you go that direction, but a reverse Nordic is when you kind of go back. So we are in a tall kneeling position. The legs are in a symmetrical stance, right? And you are kind of upright. You don't have to cross your arms that way. It's fine if you do. But what you want to do is go back, allow yourself to fall back, probably not as fast as Frank here, probably not going to go as deep as Frank here the first time. Honestly, with my patients, they get to 45 degrees. That's really good. If you can get to 20 degrees, that is pretty stinking good. If you go to like there and kind of hold it for a little while, you should begin to feel your quads. Now, this is going to start to strengthen up one of the biggest muscle groups in your body, the quads, okay? And if the quads are strong, in other words, we feel the tension into the middle of our muscle in our leg, we will not be feeling it in our knee. This is one of the things that happens. As your knee hurts, the force of walking, of squatting, of whatever happens, gets jammed in your knee. Your knee is holding all the energy. Too much energy, too much stress, too much tension. And sometimes we can't take all the tension off of the knee immediately. So we need to put it elsewhere and we need to put it onto the quad. And that's what this exercise is trying to get you to do. Take the tension off of your knee by putting it onto the quad. The muscles should really be doing the bulk of the work here. You're not going to be able to go up this far back. If you can build up to that, that's great. I want to give you these exercises because they are effective, because you can do them for a while and you'll see compounding and exponential benefits the more that you do these exercises. So I know that you're not going to get this far back. That's fine. You know you have something to work towards. Once you can get to about like 45 degrees back and not shake, maybe a little further. He's going fast today, Frank. Let's just say you can get to there and not start to shake and not keep a straight body. So basically what happens is your hips will dive back here. Your body will go forward, the knees will stay bent, but you'll see kind of an L shape, right? We don't want that. We want you to stay fully upright because this will keep our abs engaged and our back engaged. If as you're going backwards, you begin to feel that you're overextending and you feel a little bit of pain in your low back, what I want you to do is just do a tiny little curl and you'll feel your abs engage. And that will take the stress off the back. So this is great for 2 big things: getting the stress out of the knee onto the quads, then the stress off of the back and onto the abs. So there should be some tension here in the middle of the body, right? But we need to take the tension off of one place and spread it evenly. Okay? So that's the main concept with how to do this exercise. Sets, reps, these are always questions you guys leave below in the comments, but you want to try to do as many as you can. I mean, with bodyweight exercises, because you don't have the tension of your body, you got to do 12 to 15, 15 to 20 if you're serious. So with bodyweight exercises, you want to hit in those double digits pretty easily and get comfortable with that. That's how you end up shredded, like my man Frank over here. He does tons of bodyweight stuff. Okay, tons of bodyweight stuff, tons of reps. Let's go to the next one. Now this one is not at all, let's do this one because it's a little bit similar. This is the staggered stance sissy squat. So basically what you're going to do is you're going to put your feet about a foot apart, 12 inches or so, about shoulder width, left to right. And then you're going to use this front leg almost as a kickstand or support. And you're going to think about reaching that back leg down for the ground, okay? You're gonna try to keep your torso kind of erect and straight up. You can see what I mean by that is he is a little bit bent there. There's a little bit of this angle here, right there. I would like it to be straight up. It's not gonna be perfect. That's fine. That's pretty dang close. So what you do is you go down and just tap that knee and come back up. Feet about a good 12 inches apart, shoulder width, nice and comfortable. And then all you're gonna do is put a good deal of weight on this knee, but you're really thinking about reaching that leg down to the ground. Let's watch. And just a tap down. Pretty easy. Go forward, tap down. So get the idea. So you can see he's leaning over. The focus here is on this side. So this is very similar in this position, obviously, to what Frank has going on over here, right? So this is that same kind of 90-degree angle that we're talking about, where we are going to get a load through the entire front of the body, but we're looking to feel it here through the quad, maybe even higher up into the hip flexor, since the line kind of starts from there and it's going all the way down here. Midpoint is going to be somewhere through, hopefully, the front of the hip. And this is an area that needs tension and it needs to open up, because if you're like me, you're sitting right now, and this is an area that gets kind of compacted and tight. We talked about this on many episodes before. What I'm saying is this gets compressed. So this is more of like the seated position. So the front of the hip gets compressed and tight, and we need to open it up. We can open it up with both sides with this one, or we can open it up a little bit more unilaterally, kind of one side at a time. Yes, the other side is kind of opening, but really we're talking about this knee that's going down, right? So this side is opening. This is also helping to balance out the hips, right? So if you've ever been told that you have a high hip on one side, what this exercise is asking is, can you lower this hip on this side? So as you do this and reach the knee down, maybe you get a little bit of stretch here, maybe you get a little bit of a stretch here, but really think about reaching that knee downwards and opening up the front of these overly compressed hips that we are seated in all day. That's the main benefit of both of these. This is why this is huge for the low back and huge for the knees, because so much pressure gets compressed in the front of the hips and we don't get the backside working, we don't get the quads working. That's where we lead to the next one. Let's go over this one more time. Feet apart, stagger stance. Now with this one, you can stack up a bunch of reps. Keep leaning back. That's really good. Posture, really good form. You can tell they're not that hard. Okay, my man Physio Fix in Dallas here is not working too hard. He's just trying to make sure his form is right. Like I said in the beginning, how you do it is the benefits that you will get from it. So if you do it sloppy, you'll get sloppy benefits. If you do it with good posture, good intention, pushing those hips forward, keeping the chest up, then you will reap the benefits of how you did it. Okay. Okay. So the last one, let's talk about this. So we've been really trying to get the knee above the knee, the quad and the hip. These two, we've also talked kind of about the back and the abs. Let's go a little bit lower to kind of wrap this up. So in this one, we've got a little slant board. You can very easily take some plates like these over here and stack them up under your heels. If you don't have a slant board, it's totally fine. But what we are doing here basically is we've also got our hands up on the head, the prisoner's walks, right? They kind of used to call these back in high school, if you guys remember the punishment. But we're really doing that because we don't want to move this upper body. You will see that he is trying to keep his torso very still so that we feel the primary movement in this knee going forward and done by this shin. So I'll say we're trying to get this foot stable, this torso stable. So you're going to see the knee go forward and the knee go back. But what is it that is doing it? It should be this shin. Okay? I know that was a lot. But basically what I'm saying is keep your foot still and keep your upper body still. Okay? That's the main goal with this one. Keep your foot still, keep your upper body still. And then you're just basically going to rock back and you're going to rock forward. You can see he's not really leaning his upper body forward. This is really trying to get you to use your shins to pull you forward. Like I said, we've been going up high with the quads, the back, the abs. We need to go below the knee now and hit these shins. So as you do this, really try to not lean forward with your upper body. You can see he's trying to stay very still with that upper body and then just shifting his weight back and forth in his hips, trying to use those shins, right? So he's not leaning back with his head. There's a little bit of a tilt forward with the head. You're not really thrusting forward with the upper body. This is a tricky one to do, but if you can do it, it should be absolute fire on the shins, and you're going to teach your body to move from a different center of gravity. So when you're moving and doing these complicated Olympic lifts, Adam or Wes doing some pretty good stuff, complicated movements, sometimes those overly complicated movements can hide some of our problems, okay? That's really what all these exercises are doing. They're trying to pull out the problems and make you confront them, okay? So let's confront our need to move our upper body back and forth to shift our weight. Let's confront the need to move back and forth with our hips, our feet. Rather, I want you to learn to move forwards and backwards with the hips and the shins as pulling. So we've talked about it before, like lowering our center of gravity. When we're down here like this, we've certainly lowered it, but not actively moving from our head nor our feet. Like you're seeing his heels are staying down, his toes are staying down. You may feel the weight go from the heels to the toes when you do this. That's fine. Make sure that they stay down. Make sure you try to keep your upper body still. I've said it too many times. We're just going in loops now. But as you go back and forth, I'm sorry for being repetitive, but it's tough. And if you can build up this little skill, you will feel these shins go crazy. And if these shins are going crazy, not only are you going to be stabilized from your quad above, as we're doing these two exercises, you've got a little exposure down here, but really with this exercise, you're going to learn how to shift your weight with your hips and use your shins, which are two vastly underutilized things, specifically in therapy. Chiropractors, I don't see it a lot. Physiotherapists maybe talk about it sometimes, but it's a low-hanging fruit that is weak that you guys can make better. I gotta stop this episode. Thank y'all so much for listening. Comment, like, subscribe, listen to our podcast. There's links below. Thank y'all. Have a great day.